Hi everyone, Ohio State Senator Ken Smith here. Welcome to In Case You Missed It State House Edition, Shall to May edition for the week ending May 31st. This week we're going to examine the Ohio Medicaid expansion and the one word that could eliminate health care coverage for thousands of Ohioans. Ever since expanded health care coverage came to Ohio in 2013, the GOP's been trying to take it away, and now Columbus Republicans are running a new version of the same old scheme, the elimination of the Affordable Care Act, which currently provides health care coverage to approximately 770,000 Ohioans. In his proposed budget, Governor DeWine added language that essentially said that if the new Trump administration cuts even a penny from the Affordable Care Act subsidy, we will end it entirely in Ohio. DeWine said that if the federal share of Medicaid funding is reduced, the Ohio Department of Medicaid, quote, shall immediately discontinue all medical assistance for members of the group. The critical word there is shall. That is the trigger language that could lead to almost 800,000 Ohioans losing their health care coverage. DC news outlets have reported that Congress is considering billions of cuts across the social safety network, including Medicaid. Well, if the word shall remains in the Ohio budget, then almost 800,000 Ohioans will lose their coverage immediately. Those cuts would have devastating financial and public health impacts. Also, hospitals, especially in poorer and rural areas that rely more heavily on Medicaid reimbursements, would see a significant revenue loss, which could lead to their permanent closure. So can we do anything to protect Ohioans who are on Medicaid? Yes, and that needs to happen in the Ohio budget. We need to change the word shall to may. The state of Ohio has to have a choice how to handle the federal cuts should they happen, and we shouldn't let the Trump administration control our policy choices. By changing shall to may, hundreds of thousands of Ohioans won't automatically lose their health care coverage regardless of what DC does. Stripping Ohioans of Medicaid access isn't a victory, it's a public health disaster, and that's why we need to change one word. So contact your senators and tell them to protect Medicaid in Ohio by changing shall to may in the state budget. I'm Ohio State Senator Ken Smith, and that's In Case You Missed It State House Edition, Shall to May edition for the week ending May 31st.